Premenstrual dysphoric disorder, PMDD, affects about 1 in 20 women. For some women, these symptoms become even more distressing during perimenopause. But why is this the case, and how do you treat this condition? Hi, I'm Dr. A. I'm an integrative psychiatrist and lifestyle physician. Let me paint you a picture. Jessica is 45. 1 week before her period, she transforms into someone she doesn't recognize. She screams at her kids over minor issues. She becomes tearful over nothing. She feels hopeless, angry, and completely overwhelmed. Anxiety shoots through the roof, and she feels exhausted. Then her period starts, and then she improves within a few days. This isn't just bad PMS. This is PMDD, premenstrual dysphoric disorder. And these symptoms could get worse in perimenopause. PMDD affects up to 8% of women of reproductive age, but during perimenopause, those numbers climb even higher. PMDD isn't just about hormones going haywire. It's about how your brain responds to those hormonal changes. Some women have a genetic sensitivity to hormone fluctuations. Their brains react differently to the fluctuations in estrogen and progesterone levels. So it's not just hormones. It's how your brain and genes interact with them. The symptoms of PMDD go far beyond mood swings. We're talking about depressed mood, anxiety, irritability, anger, and difficulty concentrating. You may experience food cravings, bloating, breast tenderness, sleep disturbances, and a decreased interest in activities. PMDD symptoms follow a specific timeline. They typically start during the luteal phase, about 10 to 14 days before your period, then disappear within a few days of menstruation starting. And during perimenopause, this pattern becomes even more erratic. Your cycles become unpredictable. Sometimes you skip periods. Sometimes they're heavier. Sometimes they're closer together. This hormonal chaos can make PMDD symptoms feel like they're happening all the time. I had a patient, Maria, who told me she felt like she was drowning in her own emotions. She said, "I used to be the calm one in my family. Now I feel like I'm watching myself lose control and I can't stop it." The good thing, though, is that PMDD is treatable. We have evidence-based solutions that actually work. First, let's talk about the most effective treatments. SSRIs, antidepressants like sertraline or fluoxetine, are first-line treatments for PMDD. Unlike depression, where these medications take weeks to work, for PMDD, they can be effective within days. Some women take them continuously, others use them only during the luteal phase, what we call intermittent dosing. Birth control pills can also help stabilize hormonal fluctuations. Continuous dosing, skipping the placebo week, can eliminate the hormonal roller coaster entirely for some women. Many women have also experienced relief with menopause hormone therapy. NSAIDs like ibuprofen can also help with physical symptoms like pain. But medication isn't your only option. Lifestyle interventions can be game changers. Regular exercise, especially aerobic exercise, can reduce PMDD symptoms significantly. Studies show that calcium and magnesium supplementation helps alleviate symptoms. The recommended dose of calcium is 500 to 1,200 milligrams daily, often taken during the luteal phase or continuously. For magnesium, typical doses are 200 to 400 milligrams per day, often combined with vitamin B6 for added benefits. However, here's the mistake I see women make repeatedly. They try to white-knuckle through it. They think they should be able to handle it on their own. They blame themselves for not being strong enough. Now listen to me, PMDD is not a character flaw. It's not a weakness. It's a medical condition with real biological causes. And during perimenopause, you need extra support. This is where an integrative approach comes in. Also, cognitive behavioral therapy is helpful. This can teach you coping strategies. Mindfulness and stress reduction techniques can help regulate your nervous system. Sleep hygiene becomes crucial too. Your brain needs quality sleep to process emotions and regulate hormones. Create a cool, dark environment. Limit screens before bed. Consider magnesium glycinate to support deeper sleep. Nutrition matters too. Stable blood sugar prevents mood crashes. Focus on protein with every meal. Limit refined sugars and caffeine, especially during your luteal phase. Here's something most women don't do. Tracking your symptoms can be an incredibly empowering experience. Use a mood tracking app or simple calendar. Note when symptoms start, how severe they are, and when they resolve. This data helps you and your healthcare provider make informed decisions about your treatment, especially if you plan to try medications. Zoloft, for example, is a medication approved for PMDD. Watch this next video to learn about the pros and cons of Zoloft.